East. Today I present my presentation, One Health, One Medicine seminar presentation on leptospirosis, a zoonotic disease. That is a disease that is transmitted from animals to humans. I will look at different areas: background, transmission, signs and the symptoms, diagnosis, high-risk groups, prevention strategies, and the case management. Background: leptospirosis is a bacterial infectious disease carried by animals, most commonly rats and cattle. It is caused by pathogenic spirochetes of the genus Leptospira, and it is considered to be the most common zoonosis in the world. Transmission: it is transmitted through direct skin contact with contaminated water and moist soil. Vegetation contaminated with the urine of infected animals, direct contact with urine or tissues of infected animals, inhalation of aerosols of contaminated fluids that occurs in abattoirs, ingestion of foods contaminated with the urine of infected animals. Signs and the symptoms will occur within 3 to 21 days after infection, and it will include headache, nausea and vomiting, muscle pain, fever, jaundice, renal failure, and hemorrhage. Other organ systems, pulmonary, cardiac, central nervous system, are also frequently involved. Diagnosis: leptospirosis may be isolated from the blood within 7 days and from the urine after 10 days of treatment. The diagnosis is more commonly confirmed serologically by the demonstration of a rise of leptospira antibody. A single leptospira microagglutination titer of 400 or greater is also highly suggestive of acute infection. High-risk groups: leptospirosis occurs worldwide in developed and developing countries of urban and rural settings. The disease is an occupational hazard for farmers, sewer workers, miners, dairy and abattoir workers, and fish workers. It is also a recreational hazard to bathers, campers, and some sports people in infected areas. Prevention strategies: there is no human vaccine available for the infection of leptospirosis. Prevention: personal hygiene, washing of fruits and hands, education especially on modes of transmission, avoid swimming or wading in potentially contaminated water, use of appropriate or personal protection when work requires such exposure, protecting workers in hazardous occupations with boots and gloves, rodent control around human habitations, prompt treatment and isolation of infected domestic animals. Case management: antimicrobial therapy is indicated for the severe form of leptospirosis. For mild leptospirosis, treated with doxycycline, ampicillin, amoxicillin. For severe leptospirosis, intravenous penicillin G has long been the drug of choice. Persons affected by severe disease should remain hospitalized until adequate solution of organ failure and clinical infection. Occupation: outpatient follow-up may include an assessment of renal function to ensure ongoing reversal of any damage. A cardiac assessment may also be indicated in patients with symptoms suggestive of heart involvement. And finally, a leave with a thought: the health of a nation is the wealth of a nation. I thank you.